yesterday's session, I made a not small mistake, a very, very big mistake. And I'm going to talk about it first before I start my session. And what mistake I did was, yesterday I told you guys that the lifespan of a ovum is 72 hours, correct? Yes or no? Agree, right? You guys make an agreement? Yes, I did that mistake. So I will tell you that it is not 72 hours, guys. It is actually 24 hours. Okay, it's 24 hours. So why did I make such a grave mistake? Where did I go wrong? Okay, you and I both are like students now. So where did I go wrong? I went wrong in confusion between three things. Okay, let's see. I had a conflict in mind whether if I'm telling it right or what is happening here. So where did I go wrong? I'll explain, and then we can go for the very important things that we have to discuss. Where did I go wrong is 72 hours that I spoke about is the time for capacitation. Okay, I had this conflict, but yet I shouldn't have moved further in telling the answer, but I did it. Sorry about it. And then 24 hours is the lifespan of ovum. After what? After the ovulation. Only 24 hours, guys. And then 5 days. 5 days is the lifespan of sperm in female body. Lifespan of sperm in female. Okay. I am very, very sorry about it. And this is the corrected mistakes. I shouldn't have done it, but yeah, things happen. I'm really sorry about it. Okay. So please make a correction, and please, if you have written it somewhere, make sure that you scratch it out. Okay. That is the first thing you have to do. And, rewrite this. Clear? No? Can we go for today's topics, guys? Are you excited? Are you in good energy? Please tell me. And before I start today's topic, I have few things to ask you. Please tell me the class feed check. Can you see my screen? Can you see me clearly? Can you see the words clearly? Everything else clear? Yes? Yes, yes, yes. Okay. Thank you very much for the response. I'll end the poll. Okay, first, some of you who told no, probably guys, it's your mistake with what do you tell? Internet. Okay, please check your internet, close other tabs, and make sure that you open only Zoom. Then I think probably you can see. In case if you still have the problem, you can go for Avanti Live 4 channel. In Live 4 channel, you get the live feed. Probably the streaming, it will adjust the number of pixels, and you will get the stream continuously. Okay, that is also another option. Chalo, I have a question on the board, and I have launched the poll already. So tell me, guys. In artificial insemination technique, the semen is collected. The options are only from the husband and is artificially introduced into the vagina, only from a healthy donor and it is artificially introduced into vagina, either from the husband or from a healthy donor and is artificially introduced into the oviducts, either from the husband or the healthy donor and it is artificially introduced into the vagina or into the uterus. What do you think, guys? Okay, majority are saying C. Okay, majority are saying C. Okay, what is the correct option? Correct option is D. Okay, it can be either introduced into the vagina or it can be introduced into the uterus. Okay, artificial insemination can be done on both. Okay, so uteral, why we choose uteral artificial insemination? When the motility of the sperms, when the sperms are very weak and their movement is very weak, that's when we choose which one, for the uterus. If the sperms are healthy but the count is less, then we go for vaginal transfer. You get my point? Okay, so the option is D. Please make a correction. Okay, good that you responded, and I hope you just remember this. Please, 1 second. End poll. Okay, next question, guys. Infertility cases like inability of the male partner to inseminate the female are very low. Okay, sorry. Infertility cases like inability of the male partner to inseminate the female or very low sperm count in the ejaculate could be corrected by. Okay, so when a person has a capacity, don't have a capacity to inseminate into the female, or he has a low sperm count, Okay, so that, or he has a problem with ejaculation. How can it be corrected? Gamete intrafallopian transfer, zygote intrafallopian transfer, uterine, so intrauterine transfer, and ICSI, intracytoplasmic sperm injection. What is your option? Guys, come on, seriously. Intrauterine transfer, gamete intrafallopian transfer, zygote intrafallopian transfer. Can we discuss about this? Very good. So the people who told option D are correct. Okay. So let's talk about why you went wrong. When a person has an inability, okay, he has a problem with respect to the low sperm count or ejaculatory dysfunction, or he's not able to inseminate into the female. Any cases where the male is not able to do this, what we do is we collect the sperms. Let's say that the person is quite old, or he has some genetic disorders, or his lifestyle disorders are there. So he has a very low sperm count. That is our first case we'll take. So what we do is we collect the sperms, and when there is extreme low cases, very low count of sperm, collecting the sperms and doing artificial insemination will not give us the assured success. Why? Because you need enough number of sperms to make sure that it goes and meets the egg. I told you already, the sperm has to cross a lot of barriers to meet the egg. That is first thing. Second thing is the health of a sperm. How healthy is the sperm and how powerful it is, or how active it is. That is another case, correct, right? So that is why we go for ICSI. What is ICSI? ICSI, can you see the red ink? You can see that, right? Should I change the color of the ink? Please let me know. ICSI stands for intra cytoplasmic sperm injection. So intracytoplasmic sperm injection. Okay, that is why we choose. Why not the other first three? When it comes to gamete intrafallopian transfer, guys, whenever you see the fallopian word, that means what are we transferring? Egg, not sperm. Egg is transferred. Why egg is transferred? If a female is not able to produce a healthy egg, okay, then what they will do, they will take the donor egg and they put it at the fallopian tube. Why fallopian tube? You know that the fertilization happens at the fallopian tube. That's why take fallopian tube as your marker, or your clue. So whenever it comes fallopian, that means you should know that we are talking about egg. That is about gamete. Got it? No. Next, when it comes to zygote, and when you see uterine transfer, when do we do zygote transfer? When we take sperms, when we take egg, and in the outside laboratory, what we will do, in the artificial medium, we'll make them fertilize. Now, what will happen? The egg becomes zygote. The zygote will turn into 2-cell, 4-cell, and it will become 8-cell stage. Within the 8-cell stage, if I take it and then transfer, where do I transfer? I transfer directly into the fallopian tube. Okay, before it turns into a healthy morula, if I transfer this zygote within the 8-cell stage, so that is called as zygote intrafallopian transfer. So what are we using? We are making 8-cell stage. 8-cell stage. Got it? No. Then when do I go for uterine transfer? Uterine transfer, I do it more than 8-cell stage. What will I call more than 8-cell stage? It is called as embryo transfer. Okay, embryo transfer. So in embryo transfer, what will I do? I will take more than 8-cell stage and then I'll transfer it. Is it clear? Did you understand this, guys? Yeah. Can I go for the next question? Yes. So ICSI is the answer. Okay. Some important STDs and their causative agents are given below. Mark the wrong match. Very important question. I hope you write it down. Got it right? So I will relaunch the poll and then I'll read out the options. Clear, no? So what is it? Genital warts, herpes simplex virus, and then you have concroid, that is Haemophilus duceri, and then you have syphilis, that is Triphonema pallidum, okay, and then you have gonorrhea, that is Neisseria gonorrhea. So which of the which of the following you think that it is a wrong match? Can you please tell me? Which one do you think? It is very predictable also. Okay, there is some information that we have to make sure that it is in our head as well as in our books. Make sure. Okay, can I tell? Only one response I have got. Should I read the options again? Let's go. Some of important STDs and their causative agents are given. So genital warts, it is herpes simplex virus, and then you have concroid, that is Haemophilus duceri, and then you have syphilis, Triphonema or Triponema pallidum, and then you have gonorrhea, that is Neisseria gonorrhea. Which one do you think? Some say A and some say B, and I have only how many? One option. Only two people are responding. Is it three? Okay. Now can I go? If you think that, oh, this is a complex question, it's easy, very easy. Okay, listen. See here, herpes simplex virus. What does it give? I mean, like, what does it cause? It causes herpes. Okay. What kind of herpes? Genital herpes. That's why you read both the option so that your answer, odd one out, you can see, or you can see which one is not properly picked up. Okay. So whoever has told it is A, that is right. Genital warts are actually not caused by herpes simplex virus. So then what is the causative agents for genital warts? Okay. So it is HPV. What is HPV? Human papilloma virus. Sorry. Okay. Is it clear, guys? So you know that now the genital warts is caused by human papillomavirus, and the herpes simplex virus causes what? It causes genital herpes. Okay, no, it causes genital herpes. Clear, right? So what about this? For example, maybe you're listening to this for the first time. That's why many of you went for the option B. What is concroid? Concroid, what will happen in this particular disease? You get something called as lesions. Lesions or some kind of ulcers. Okay. Ulcer. So they are almost looking like syphilis, but they're not syphilis. In syphilis, what will happen? You know, ulcers, right? Ulcers are like boils. Like how the white color thing comes out and there is a pus inside that. For example, you might also get mouth ulcers because of excessive heat. They almost look similar. But what will happen here in syphilis, if you see there is a pus formation, like a bubble it forms. But in concroid, it is not a bubble form. Okay, it causes this kind of an ulcer creation or lesion creation, especially in the genital tissue, okay, in the vagina of a female. Now here, what kind of a disease it is? It's a bacterial disease. And what is it caused by? It is caused by Haemophilus, okay, duceri. Haemophilus duceri is a causative agents for concroid. Please write it down, okay. Sometimes it has come and many of us go for option B. That is a reason. Got it, no? Next is syphilis, Triphonema pallidum. Probably you know this. We'll discuss about syphilis and how deadly disease it is in this session. Next one, gonorrhea. Gonorrhea is also Neisseria gonorrhea. Okay, this also we discuss. Is it clear? Okay, I hope the doubts is cleared. Can we go for the next question? And the next question here is, let me launch the poll because you guys are fast. Okay. Okay, tell me, which of the following statements is not correct about the contraceptive pill Saheli? High contraceptive value with few side effects, developed by a scientist at CDRI, Lucknow, and it is a daily pill and it's a non-steroidal preparation. Which do you think that is not correct about your Saheli? Come on, make it fast, guys. Good response. Perfect. So yes, we have the majority of the answers. The people who have answered option C, okay, option C, they are correct. Why they are correct? Because it's not a daily pill, it is a weekly pill. It is a weekly pill, guys, okay. And then what about the rest of the options? Rest of the options are correct. It is a non-steroidal preparation. Yesterday we talked about it, and I spoke about the features of Saheli and why it is very much preferable over the other types of contraceptive pills, because it is non-steroidal. It does not affect too much on the human female body, and that's why it has least side effects. Got it? High contraceptive value with least side effects. Okay, anyways, tell me, what is CDRI? What does CDRI stands for? What does CDRI stands for, guys? Yes, option C, correct. Tell me what does CDRA stands for. You guys put me in the message. Okay. Next one. GIFT, gamete intrafallopian transfer, is applicable to a female who cannot produce an ovum, provide suitable environment for fertilization, provide suitable environment for further development of the fetus, and then you have all of these. Okay. So this is your question, and I will, meanwhile, I'll also check the answer for the prior question as well while you read and answer this. Okay, let's look at this. Central Drug Research Institute. Perfect. Correct, guys. I appreciate it. Thanks for the response. You're right. Anusha, Kshama, and then Shreya. Thank you for the response, guys. Okay, let's go for the next question. This is your question. GIFT, that is gamete intrafallopian transfer, is applicable to the female who cannot, tell me, produce an ovum, provide suitable environment for fertilization, provide suitable environment for further development of the fetus, or all of the above. Where can we use GIFT? Okay. These are very simple questions, guys. You know, the more time you save in solving these questions will give you access, like additional time to solve physics. I know you guys, some of you guys might struggle either in physics or in chemistry. So that's why we need to make sure that we know the basics very strongly so that we don't waste time. Okay, that doesn't mean that we have to do things in hurry, but we can get 50 to 70% of the answers in our head. Okay, chalo. What's the answer? Majority say A and some say B. And should I surprise you? Yeah, I will surprise you. Okay. So let us say that gamete intrafallopian transfer is applicable to the female. So who cannot produce an ovum, who cannot provide, who does not provide a suitable environment for fertilization, provide suitable environment for further development of the baby, or all of this above, produce an ovum. If a female cannot produce a healthy egg, okay, or if she is too old, then she has a proper, very well developed uterus, when she can go through the implantation process properly. If she can do the rest of the things properly, then we only go for GIFT, that is gamete fallopian transfer. That's why we don't go for B. Okay, got it? There is no problem with suitable environment for the fertilization. Okay, she has a suitable environment for fertilization. That's why we are putting the gamete in fallopian tube. Clear? No? Many of you told it as right option, produce an egg. So this is the correct option. Okay, I was just kidding with you. Anyways, tell me which of the following is true for subdermal implants like Norplant? It reduces frequent visits to clinics. It ensures an even release of hormone. It is non-biodegradable and need removal at the end of its use, and all of the above. I think this is also a little bit easier for you guys to answer. Let's see your response. Good that many of you are getting the answers correct. Which of the following is true for subdermal implants like Norplant? It reduces frequent visits to clinics. It ensures an even release of hormone. It is non-biodegradable. That's why it needs removal at the end of its use, and all of these. Okay. So only 2 responses we have. Come on. Fast. If you want more important topics to be covered today, finish it. Good. Now we have 3 responses out of 8 responses. Let me wait for one or two. Come on, students, participate. Yeah. Chalo, can I answer? Yes. So all of this is the answer. And if you think, who told it reduces frequent visits to clinics? It is, which of the following is true? Okay, all of this is true, correct? No, you do not go to the clinics very often. Why? Because this is the one. It ensures even release of hormone. What hormone? LNG20. What is LNG20? Levonorgestrel or LNG. Levonorgestrel is the hormone. It releases slowly into the bloodstream. That's why they don't have to visit to the clinics very frequently, and it's a very good contraceptive as well. And moreover, it is non-biodegradable and need to be removed at the end of its use. So it is all of the above, guys. Okay, so let's go for another question. Which of the following STDs cannot be treated with antibiotics? Can you tell me? Okay, I will relaunch the poll. Which of the following STDs cannot be treated by antibiotics? So genital herpes, then you have chondroid, then you have syphilis, and then you have gonorrhea. Yes, very good, very good. Correct, guys. Genital herpes, because you know that it is virus. Correct, right? Virus cannot be treated by an antibiotic. You need antiviral drugs. You're nice, very perfect answer. And the rest three are bacterial diseases. That's why they can be treated through antibiotics. So it's very easy, isn't it? So let's go for the next one. Which of the following agents of STDs can cross the placental barrier? One is trichomonas, HIV, and then we have uh, uh, treponema, and then you have both B and C. Which one do you think can cross the placental barrier? Okay, I will relaunch the poll. Hold on. Please answer, try to answer this. See, so many topics covered in questioning round, right? Which of the following agents of STD can cross the placenta? Okay, trichomonas, and then you have HIV, and then you have your treponema, and then you have both B and C. So some of you are saying B, some of you are saying D. Where is the majority? Now we have a democratic situation where both have 1 and 1 votes. Come on, okay. Now the D is taking lead. Now the B and D is tied up. One more vote. If I get one more response, then I will be satisfied. Okay, do we have one more response? Anybody? No? So we tie at B and D. Let's see. So B is also correct. D is also correct. But our option D says B and C. Of course, the people who think that it is only HIV, you have to change a little bit. Along with HIV is also syphilis. Okay. Okay, syphilis also has the capacity to cross the placental barrier and cause the disease to the newborn or before birth. So it's both B and C. HIV is AIDS, human immunodeficiency syndrome. Acquired immunodeficiency syndrome. Really sorry. And then you have your syphilis as a C. So both of them cross the placental barriers and it causes the infection to the fetal infection can occur. Now, what about this? Trichomonas vaginalis is a bacteria which causes trichomonosis. Got it? So that is a disease and it does not cause a placental barrier. So that's why our option is D, guys. Okay, D wins. But the odds gives B. You have chosen B as the answer. Now make a correction that both HIV and syphilis have the capacity to cross the placental barrier and cause an infection to the fetus. Clear, no? In intracytoplasmic sperm injection, ICSI, a sperm is directly injected into the ovum, okay, placed in ovary, oviduct, uterus, and nutrient broth. What do you think is the correct option, guys? Come on, this should take less than 10 seconds. Tell me. In ICSI, a sperm directly injected into the ovum is placed in where? Ovary, oviduct, uterus, nutrient broth. Okay, some say it is uterus and some say it is nutrient broth. The fight is between C and D, but majority of the votes is going for D. So I will also go, some people are saying A, but the thing is, guys, the answer is D. Okay, in the nutrient broth. So we take the sperm, we take the ova, and then we put it in a proper nutrient broth. What is a nutrient broth? A nutrient broth is a very well prepared prepared broth means right, like a soup, but we cannot call it as a soup. But why do we call it? It's just mimics the environment, just like how our body fluids and how our body environment is very suitable for the fertilization to happen. The same environment, same conditions, and same compo like pH and whatever is there in the surrounding, the same chemical and physical characteristics are put in this broth, and then what will happen? The fertilization can happen without any hindrance. So this is called as nutrient broth, like a culture broth, but we don't call them we can call them culture broth also. So the answer is nutrient broth, I think. Okay, last question. Okay, if you're wondering how many more questions, this is the last one. Okay, which of the following statement is false? WHO has defined reproductive health as a total well-being in physical, emotional, behavioral, and social aspects of reproduction. Next one. Incidence of infections of HIV STD is maximum in individuals of age 15 to 24. Now, family planning was initiated in 1951 in India, and none of the above. Yes. So people say D. Some people A, some people C, and most people D. So I go with the most people. Okay, that's how we elect. Correct? No, in this independent India. Okay, but not every time when they're wrong, when they're right, we go for right. So the answer is none of the above. Clear? No. So all these statements are right. Please take a note at this. So okay. So if you think that reproductive health is not being physical, emotional, behavior, social, okay, aspects, okay, if they are not healthy in social aspects, it is not called reproductive health. So think again, all these aspects should fill up, then the society is called as reproductively healthy. Even an individual is reproductively healthy when he fulfills all these criteria. Second one is STD is maximum in which age? Between the age of 15 to 24, because they are more social groups. 15 to 24 is called as very social groups. They go and mingle with many people, do many things, they're wild, they're very adventurous. That will lead to STDs. Got it? Next one is family planning was initiated in 1951 in India. Yes, we discussed that. India is the first country to do that. So correct, no people? Okay, can we go for our further topics? Chalo. So we were discussing about this. Okay. So during our course of discussion, we had stopped at this point. Okay. Hold on. Yeah, there is nothing else. No concerns. So I can continue. So let's continue here. So I will give you some important information. Okay, today. So you make sure that you carry it. So what is that? Next one is sexually transmitted diseases. I know that this is a very, very important topic, and 100% a question is coming fixed, okay, in your NEET paper. But how do I get it right? So getting it right is very, very easy, and we are going to finish it within 1 or 2 slides. So how do we do this? So whichever the disease is transmitted through sexual contact, it is called as sexually transmitted diseases, or venereal diseases, or VD is also the another name for sexually transmitted diseases. Now remember, RTI also is called as sexually transmitted diseases. What is it? RTI, reproductive tract infections. Okay. So here examples for the STDs are gonorrhea, syphilis, genital herpes, chlamydiasis, genital warts, trichomonosis, hepatitis B, HIV, which leads to AIDS, which is a syndrome. It's not a disease, it's a syndrome. Now, before I talk about this slide, I want everybody, can you see this slide very clearly? Because I need you to note this down and make a note of it in your book and participate with me while we summarize this particular particular slide. You cannot see clearly? Okay, nobody can see clearly. Okay, I understand. Just give me 1 minute. I will try to fix it for you. Now is it fine? Little bit? Little bit? Okay, at least to the two. Yes, yes. If you guys can see it, some people say yes. Okay, now you can see. Perfect. Okay, follow me. If you, anyways, I'll underline. You can follow my speech as well. So we have the disease, causative agent, and the symptoms. And then we have two separate columns, which are curable sexually transmitted diseases, and which are non-curable or incurable sexually transmitted diseases. Okay, guys. So just please focus here. First one we are talking about is gonorrhea. Gonorrhea is a disease. So it comes under the category of curable sexually transmitted diseases. And the causative agent for this gonorrhea is a bacterium. Okay, remember this. This is also very, very important. It's a bacterium called as Neisseria gonorrhea. And some of the symptoms that in gonorrhea comes is, okay, hold on. Somebody has a concern, please. Sorry. Sir, we cannot see clearly. but some of them are seeing clearly. That's what I'm telling. Sirisha, please, what you do is you follow my words, and I'm doing it very, very slowly. First one you talk about is gonorrhea. Write it down. Okay, it's blur. Others, can you confirm? Is it the same? Who can see clearly? Can you please confirm, guys, faster, so that we don't waste much of the time and we can go for the solution. Clear? It's clear, guys. Okay. Okay. Do one thing. What solution I can give you is, guys who cannot see, for example, Veena and Sirisha. Okay. So you guys can either note down as much as possible, or I can just drop this picture by the end of the session, or drop me your email ID. I can send this slide. Okay, that would be nice. Okay, now it's okay. Okay, fine. That means it's your internet problem. Let's go back. Let's go back. Okay, we don't have much time. So gonorrhea, it's a bacterium. The causative agent is called as Neisseria gonorrhea. What is very, very important, guys, is first thing is the name of the disease and the causative agent. Remember this. That is very, very important. Which one is curable? Which one is incurable? That is the most important aspects here. And one aspect I already discussed. Which disease can cross the placental barrier and cause an infection to the fetus? I have told you it is syphilis as well as it is the HIV. So that also you should have taken down. Hopefully you've taken down. So let's see what is gonorrhea. Gonorrhea, actually what will happen once a person has gonorrhea, they will take urinary tract infection. It is called or it is also called as reproductive tract infection. So here they will have painful urination and pain around the urethra. The initial stages is there, and then eventually what will happen, the infection passes down the urethra, and finally it will it will move up to the bladders. You understand my point? So that is what is gonorrhea. So in gonorrhea, people have painful urination as well as they have pain around the urethra. Got it? No. Next one is syphilis. Syphilis is very, very, very deadly diseases. It comes in 3 stages. Okay, we'll talk about it. See, it is caused by a causative agent called as bacterium. Okay, Treponema palladium. So remember the name of the causative agent, please. So they will give it as this much only. Okay, Treponema palladium they might give, or they might give just Treponema. So either way, we are talking about syphilis only. Got it right? So in syphilis, what will happen? There is itching, fluid discharge, pain in the urinogenital tract. Okay, this is some of the very basic syphilis symptoms. So in syphilis or syphilis, what will happen is you have the disease in 3 stages: stage 1, stage 2, and stage 3. The people who go to stage 3 are incurable, and the death is the only end. Okay. In stage 2 also, they are up to a certain stage they can cure. After that, they cannot cure. So it comes with a minor rashes around the body, and then it will disappear. In the second stage, what will happen after 6 months or a year? Again, the rashes will return. You get my point? At this point, the rashes will cause bleedings. Got my point? And then again, it will cause fever, and for a certain period of time, there will be fever and there will be uneasiness, and then it will disappear. In the third stage, what will happen? It will come back in a more severe force. So here, this time, whatever the lesions that is caused on the skin, it will start bursting out. Pus will be oozing out in the genital tracts, in the skin, in the gums, and in the eyes. The bleeding will be there. Internal bleeding will be there, and it is very, very painful, and it is horrible to even imagine such a kind of a symptom. That's why we should never ever neglect. Whenever there is a mild difference in the body, we have to go for the medics or the doctors to get it checked. So come again, syphilis, the causative organism is called as Treponema palladium, and then the symptoms is itching, fluid discharge, pain in urinogenital tracts. Got it? Chlamydiasis. Chlamydiasis is also a bacterial diseases, okay, called as chlamydia. Please make sure that you write that bacterium, and then you write the causative agent called as chlamydia. Then what is this thing? I mean, like the symptoms: painful urination, okay, especially during the intercourse. Okay, even the pain during the intercourse time. Then there is a mucus discharge or white discharge from the penis or in the vagina. So mucus discharge, painful intercourse, and urination would be chlamydiasis. Got it? And it is caused by a bacteria called as chlamydia. Next one is genital warts. Genital warts is, we'll discuss that one in the first slide. Which of the following is not a correct match? So here it is. Genital warts is a virus called as human papilloma virus. So remember this, it's a very, very important one. Genital warts, it's a viral disease. That's why it cannot be cured by antibiotics. Okay, and it is a curable viral disease. Got it? So it is caused by an agent called as human papilloma virus. And what will happen? They are external genitalia. So there is warts in the sense a kind of lesions on the external genitalia. Okay, and then vagina as well as in the cervical region. Got it? Especially in the females. So this is the most common STDs that is found in a young college groups. So genital warts. Okay. Next one is trichomonosis. Okay, vaginalis. Trichomonosis vaginalis is a complete name. Next one, you have the protozoan disease. Trichomonosis is a protozoan disease. So you have Trichomonas vaginalis as the causative organism. They also can react to antibiotics and they can be suppressed to a certain extent. And what is the trichomonosis symptoms is, in female, there is inflammation, itching, and then you have whitish frothy vaginal discharge. Okay, vaginal discharge means like a fluid. It will be coming like a fluid. Okay, it is called as leukorrhea. Okay, why leukorrhea? It looks like a froth. Okay, or what do you tell? Surf froth, like that. Got it. Next one, males remain asymptomatic. Male are not symptomatic to this particular disease. Which one? Trichomonosis. But sometimes, occasionally, there might be swelling in the seminal vesicles of a female as well as, male, and then the prostate glands of the male. Seminal vesicles as well as prostate glands are the reproductive glands of males. So there might be swelling there. Apart from that, female is the one who is suffer from. Which one? Trichomonosis vaginalis. Okay, vaginitis. The name of the organism is a Trichomonosis vaginalis. It is a protozoa, so it reacts to the antibiotics. So in females, there is inflammation, itching, whitish, frothy discharge, okay, in the vagina. And then this is also called as leukorrhea. Males are asymptomatic, so that's why they have sometimes, in some cases, there might be swelling near the seminal vesicles or near the prostate glands. So this is a list of the curable sexually transmitted diseases. Done. Next one, we go for incurable sexually transmitted diseases or incurable STDs. First one is AIDS, acquired immunodeficiency syndrome. So there is a special topic of acquired immunodeficiency syndrome, especially in human health and disease. We talk about it in a very detailed sense of how this disease, life cycle of the virus, symptoms of the disease. So AIDS is a syndrome. It's not a disease, excuse me. So why it is a syndrome? Whenever we call a particular condition as a syndrome, that means it is multi-symptomatic. What is multi-symptomatic? Multi-symptomatic is a condition. Imagine a patient is there and he comes up with the symptoms of typhoid one day. And then doctor thinks that it is typhoid and he treats. And the next day he shows the symptoms of some fungal disease. And the next day he shows the disease, symptoms of dengue. Or he shows some of the other bacterial infections, or mostly it is a TB. Tuberculosis is one of the most common infections that happens with respect to AIDS patients. So whenever they show the symptoms of more than one disease, it is called as a syndrome. So that's why AIDS is acquired immunodeficiency syndrome. This is a disease where the human immune system fails. So when the immunity means it's like a protection, right? It's just like a defense. It does not allow any of the other outside agents to come to your body and control your body or destroy your body. So if this security system fails, what will happen? Anybody, generally what we are actually immune. Our body has learned to defeat so many of the enemies which cannot be seen by us. So suddenly if the defense system falls down, what will happen? All these agents can come together and start causing an infection. That is called as acquired immunodeficiency syndrome. Got it? And it is caused by a virus called as human immunodeficiency virus or HIV. Now, there are multiple symptoms. You can write any symptoms with respect to HIV. Got it? Next one is genital herpes. It is herpes simplex virus. either it is type 1 or type 2 type of virus. So what happens in herpes, genital herpes? It is incurable, guys. Once you get the herpes, it is incurable. Okay, remember. Next one is reddish ulcers over external genitalia, and then you have a vaginal discharge. It is a mild type of disease, but the only problem is you don't have, it can be cured, not cured, controlled. The symptoms can be controlled. It will stay. It will stay uh, all the time. But the symptoms sometimes appear and symptoms can not appear sometimes. Okay, depends on your physiology. Next one you have is hepatitis B. So hepatitis B virus is the one who is responsible for this disease. Even this is incurable. Now what will happen? Hepatoma or hepatitis, hepatic is always related to liver. So first you have is fatigue, that is tiredness. Then you have persistent low grade fever. So always you feel feverish, but you don't feel like, oh, there is a very high temperature. You have a low temperature feverish because of the fatigue. Next one is jaundice. You know the jaundice is caused by, like it is caused to your liver, right? Whenever there is a liver malfunction and there is accumulation of bile, okay? Then you have jaundice, you have rashes, and then you have abdominal pain. So that's why it's a liver infection. Even this one does not go for a very long, forever. Only it can be corrected and it can be suppressed. You don't know when it's going to come back. Okay, that is the problem. Whenever the immune system is too low, they come back. Whenever it is like little functional, they reside. Like they keep quiet. Sir, after genital herpes, it's not visible. Okay. After genital. Okay, genital herpes. Next one is hepatitis B, guys. Hepatitis B is the next question. Next one, please take down hepatitis B. Okay, in hepatitis B, what do we have? We have hepatitis B virus is the one. Fatigue is the first symptom. Persistent low-grade fever. Persistence means continuous low-grade fever. Okay, got it? Continuous low-grade fever. Next one you have is jaundice, rashes, and abdominal pain. I hope you have got the thing. Got it, Veena? Yes, I can share the PDF. I will share the PDF. Okay, got it. Chalo. Now this is very, very important slide, guys. Okay, so make sure that you have it and you know about it. Okay, so we have finished STDs. Next one, all of them. Okay, so usually in STDs you have general symptoms. What are the general symptoms of STDs? This is also can be a question, even though sometimes they don't specifically ask about what is the symptoms of genital herpes, what are the symptoms of your syphilis. They don't ask. Maybe sometimes the question, most probably the question comes like this: which one is that? What are the symptoms of STDs? So sexually transmitted diseases. Remember, what earlier symptoms of the STDs is usually itching, fluid discharge, slight swellings, abdominal pain, okay, etc. And sometimes they also have, okay, pelvic inflammation disease, okay, pelvis, okay, in the females, it can be inflamed. So that is another thing. And some of them also would lead to, so usually the people whose pelvic is infected and they have swelling in the pelvis region. What is pelvis? Pelvic girdle or the hip girdle. You know that this is very, very important, especially in female. What will happen? The expansion of or elasticity of the pelvis is very, very responsible for accommodation of the baby as well as birthing. So the pelvis has to expand. So if the pelvis does not expand, now what will happen? That will lead to abortions, that will lead to stillbirths or ectopic pregnancies or infertility or even cancer, okay, of the reproductive tract. It can be cervical cancer, it can be uterine cancers, okay, or it can be ovarian cancer. So this can be some of the symptoms and causes of pelvic inflammation diseases. Got it? Very, very important. So you understand why pelvis is very, very important, especially when it comes to the phase of post-fertilization, right? So when the pelvic is having inflammation and infections, that will lead to a lot of complications during the birthing process, guys. Okay, next one. All the persons who are vulnerable to STDs, okay, so are between the age group of 15 to 24 years. So this is another very, very important slide. Next one is, how do we prevent STDs? It's a very generic question, okay? What does ectopic pregnancy mean? Ectopic pregnancy is when you have an implantation not at the suitable position. For example, we have the uterine fundus. Uterus is there and then you have a fundus region and let me draw. See, if this is the uterus, okay, this is the cervical region, this is the uterus. Usually what happens is there is this thick region called as the uteral fundus. So this uteral fundus region is a most preferable region where you have the implantation, preferable place where your embryo can go and attach to there. Why? Because the maternal tissue can integrate very well, and the development can happen. That's what the normal process happen. Ectopic pregnancy can happen like where at a very unusual locations, like at the cervical region, okay, at the beginning of the cervical region or near somewhere here. If the implantation happens, that will lead to ectopic pregnancies. Okay, ectopic pregnancies. So this is called as ectopic pregnancy when the implantation has not occurred at the right location. So at that point, you know that the baby turning, the development of the placenta is all completely becomes a mess, and then the birthing process becomes highly complicated. Correct, right? So that is the another reason. So prevention, I hope it is clear for you. Okay, I don't know who asked, maybe. I hope it's clear for you guys. Next one is when it comes to prevention, we know that avoid sex with multiple partners, always use condoms during coitus, okay, with unknown partners. Next one, whenever we have doubts or whenever we have uh, any doubt or any feeling that something might be wrong, please go to the doctor. Use self-diagnostics. Don't use Google, especially if for a headache, the Google says that you have brain cancer or a brain tumor. So that's why we should never trust what is written on the web. You always need a medical counseling and medical diagnosis so that you prevent it rather than suffering. There is no problem because you are more important than the society. What society thinks about you is secondary. Okay, that's why you get yourself healthy and take care of yourself. Got it? No? Chalo. Next one, infertility. This is a very small topic, an important topic. Anyways, we have covered most of it in our questioning. We will discuss about it in the next class. Before you go, sorry, please take time to fill this form every day. Okay, I mean, like, take this as an assignment, please.